Dr. Gunn-Nolan. I work as the Chief Medical Officer here at Sovah Health. I also work as a part-time clinical physician, bedside to take care of our COVID patients and in our community. We wanted to go ahead and provide another update to the community because things have certainly changed. Over the last few days, we've ranged from 71 to 76 people within the hospital. Unfortunately, the concern is that this number will continue to rise. It's unclear if this is because of holiday gatherings or other factors, but certainly this is not the trend we want to be going. I encourage you all to wear your mask, practice good hand hygiene, social distance. If you are having symptoms, fever, chills, sore throat, runny nose, short of breath, consider getting tested and please consider quarantine. If you are found to be positive for COVID-19, quarantine does not include going to the store to get groceries or even going to your church or place of work. This means that you need to stay home. It is so imperative that our community understand this. COVID-19 continues to take the lives of many Americans every day. At this point, we are reaching levels where we are losing the same amount of Americans on a daily basis that we lost on 9/11. Again, this can't continue. I'm happy to report that at this time, Sovah Health continues to vaccinate per the state's guidance as we continue with our 1A category. We are ready and prepared when the state opens up to the 1B or 1C categories as well. We are happy to offer this vaccine to our staff and all of those within that 1A category, including those frontline workers. I'm happy to report I'm vaccinated. I received this vaccine because it was so imperative that I take that first step to providing protection for my community, myself, and those that I love. I encourage you all, when you are eligible, consider vaccination. There is so much information out there that is actually incorrect and blatantly false. This vaccine has been researched. This vaccine is a safe vaccine. This is our first step in fighting this fight. We finally have a tool and a weapon to prevent a COVID-19 infection. I encourage you all to strongly consider it. When we talk about the COVID-19 vaccine, there's so much information in regards to side effect profile. I'd be happy to share my experience after getting vaccinated. My first vaccine caused a mild headache. It didn't honestly even require a Tylenol. My arm was slightly sore, similar to a flu vaccine, and that went away. Commonly, people have a stronger reaction to the second vaccine than the first. This would be your second time being introduced to coronavirus, and those that have been diagnosed with coronavirus will have a stronger reaction even to that first vaccine, similar to others with a second. My experience with the second vaccine was honestly something I pretty much expected. 12 hours after my injection, I began to have chills, I had body aches, and my arm was quite sore. 4 hours after that, it was as if nothing had happened. Took a Tylenol, never had a fever, never had any other symptoms or issues, and the next day when I woke up, everything was perfectly fine, again, as if nothing had happened. We do have staff that have had GI symptoms, some have had fevers, and again, those who have had COVID-19 are more likely to have a stronger response to this vaccine. All of those symptoms go away within 24 to 48 hours. My common question I get asked are, what are the long-term effects of this vaccine? My response is, what is the long-term effect of COVID-19? We are starting to see people come to the hospital months after their COVID-19 diagnosis with other issues, and we're still learning what that involves. We know patients can be at increased risk for heart attacks and strokes and other blood clots. This is a very serious matter, and time will only continue to tell us what those symptoms long-term are of COVID-19. When we talk about what this vaccine can do, again, those symptoms resolve in 24 to 48 hours. COVID-19, it appears, for some, will cause a lifelong change in their status. And for others, they did not win that fight. For those, we have to win that fight. please consider vaccination.